If you want to shine like a sun, then first you have to burn like a sun. So now we are going to move for the next topic, that is the arteries, veins and then nerves of the upper limb. So this is the one simple diagram for the quick revision. Yes. So you can see, sir, there is our arch of aorta which is giving rise to the our right brachiocephalic artery. Yes, which is dividing into the our right subclavian and right common carotid artery. This is the our left common carotid and this is the left subclavian artery. So the subclavian artery, yes, the same artery is continuing as the axillary artery, same artery is making the brachial artery, then same artery is making the radial artery and the ulnar artery. Yes, remember the radial artery is giving rise to the superficial branch, ulnar artery is giving the superficial branch. Superficial branches are meeting together and making the superficial palmar arch, while the deep branches are meeting together and making the deep palmar arch. Now, what is the utility of this one? Yes, if these arteries of the upper limb, they are blocked in peripheral vascular disease, or you can say Burgess disease, thromboangiitis obliterans. In that situation, we have to perform this our Allen test, important for the clinical. So remember, we have to make the tight fist, then compress the radial and ulnar artery, then open. This will show the paleness. Now open the ulnar artery. Yes, if the ulnar artery is okay, superficial palmar arch is okay, the blood will flow and it will become normal. Yes, and the opposite if you will do, then that is a reverse Allen test. Reverse Allen test is the term which is not used everywhere. Few author, few physician, they are using this one. Yes, that is the test for the radial artery deep palmar arch. Now we are going to see the few important branches. Yes, remember few things like the branches of the subclavian artery. So the subclavian artery branches you can remember with the formula V, I, T, C, D. Remember, V for vertebral artery, I for internal mammillary artery, T for thyrocervical trunk, and C for costocervical trunk, D for dorsal scapular artery. Okay, sir. So remember this vertebral artery, if it is blocked, then what will happen? Sir, it gives the posterior inferior cerebral artery which is supplying the lateral part of the medulla. So it is getting affected, and lateral medullary syndrome or Wallenberg syndrome. Every point is MCQ. Internal mammillary artery is the best artery for the coronary artery bypass grafting. MCQ. Yes. Then thyrocervical trunk. Sir, it divides into the three branches. You can remember the mnemonic SIT. S for suprascapular artery, I for inferior thyroid artery. So remember, this is very important. Yes, your EMS NEET 2018 question pattern, you can say the inferior thyroid artery, it is the blood supply of the thyroid gland, it is a branch from the thyrocervical trunk which is coming from the subclavian artery. VITCD is your mnemonic. Also few point 8, you can see the VIT, these are the branch from the first part, this is the branch from the second part, and D is your dorsal scapular artery, this is the branch from the third part. So these are the different branches. Now you can observe the more things. एक और point बेटा, axillary artery. Sir, it is divided by the our pectoris minor muscle, which is the key muscle of the our pectoral region. So whatever we studied in our detailed regular class, yes, we are covering the same thing in our 10-hour duration. Yes, axillary artery is divided by the pectoris minor into the first part, second part and third part. Remember, the first part is having the one branch, second part is having the two branches, third part is having the three branches. So try to catch this point, which is the first part, which is the first branch. Answer is the superior thoracic artery, SATA. The second part is giving the acromiothoracic artery and the lateral thoracic artery, ATA and LATA. Third part is giving the three branches. Yes, you can remember they are the our ACHA, anterior circumflex humeral artery, the posterior circumflex humeral artery, PACHA, and subscapular artery, SASA. So do you remember? We remember this all in our regular video in this way. Yes, SATA, ATA, LATA, ACHA, PACHA, SASA, SATA, ATA, LATA, ACHA, PACHA, SASA, SATA, ATA, LATA, ACHA, PACHA, SASA. So just dance and yes, repeat this word, repeat this song every time, and you will be able to remember the branches of the axillary artery also. Okay, sir. Now we are talking about the veins of the upper limb. So there is our dorsal venous arch on the back of the our hand. Then the cephalic end of this dorsal venous arch, it will run towards the our clavipectoral fascia. Sir, that is the cephalic vein. While the basal part is running at the base of the hand, it is reaching again to the our axilla part, basilic vein, and this is the antecubital vein, median cubital vein. It is a shunting vein between the cephalic and the basilic vein, opposite to the cubital fossa, and one more vein, median vein of the forearm, which is just at the palm and opening into the antecubital vein. Forget everything, but remember this antecubital vein, median cubital vein. Sir, this is our best vein for the intravenous injection. So 100% bioavailability you found here. Okay, sir.